Hello and welcome to Diabetes Destroyer Talks. Patients often tell me, Doctor, I'm diabetic, so I only eat fruit for breakfast. Is that a good idea? So let's look at this. Fructose. Fruit contains a type of sugar called fructose. Now, fructose is a principal driver of type 2 diabetes and other metabolic diseases. This is what the studies tell us. A principal driver of type 2 diabetes, that means that it causes type 2 diabetes. So for a diabetic to be taking fructose, you can understand it's probably not a very good idea, correct? Also, it increases the blood triglyceride level. Triglycerides are inflammatory, they lead to heart disease. It increases obesity. Fructose does not lead to an insulin rise, which is what sugar does. So, and consequently, it does not also increase a hormone called leptin. Leptin is what makes us feel full. How I remember it is that there are two hormones, ghrelin and leptin. Ghrelin makes you greedy, leptin makes you lean. So, ghrelin stimulates appetite, leptin decreases appetite. So, fructose does not increase leptin. That means it does not increase the suppression of appetite, and therefore you can't possibly eat more. High fructose can lead to the formation of uric acid, and therefore you can have gout and also increased risk of kidney stones. And therefore, not just for diabetics, but for everyone, to consume a lot of fruit is not a good idea. What are the healthy fruits that you could consume? Maybe a piece of pomegranate, maybe half a pomegranate because it has got a lot of good phytonutrients. Maybe a little small handful of jamun when they are in season. And some berries. Again, a limited amount, you can't go overboard. But of course, the availability of berries is pretty limited. So save that for a very occasional treat. Thanks for watching.